So Dr. Scott Hayden here at Austin Plastic Surgery Institute, and going to talk a little bit today about weight loss and some of the things that can go along with weight loss and side effects. As everyone knows, with semaglutide, tirzepatide, which are known as Ozempic or Wegovy or Mounjaro, there are things that do go along with it. And so we're very careful to counsel our patients at the beginning so that they understand these things, and we'll talk a little bit about potential ways we can mitigate some of these things. Things that you hear people talk about is Ozempic face. They're about muscle loss, hair loss, constipation. Not everyone gets all of these things, but the important thing to understand is we do start everyone at a very low dose so that their systems can kind of get used to it and hopefully, again, minimize some of these side effects. Ozempic face is sort of a catch term that people talk about, and really it's what happens with anybody that loses weight. So as we age, our skin does get thinner. It loses its elasticity, which is kind of that ability to sort of stretch and snap back. We lose some of the bony platform. In other words, the stock within upper and lower jaw is not as much as it once was, and so when the face used to push out a little bit, when that bone recedes, then the face can kind of go down a little bit with age. But the fourth thing that does happen in everyone is that there are some small fat pockets, particularly within the central third of the face, that do deflate, and that is another thing that can kind of show some aging. And so we do some things here to try to, again, lessen that effect. When you talk about Ozempic face, it happens with everyone that has some weight loss. You will potentially notice some additional frown lines, some hollowness around the eyes and the cheekbones, as well as obviously some sagging skin. So personally, I started this a little over a year ago. I've now lost over 30 pounds. I'm almost completely off the medication now. Some things that I did in an effort to reduce how much aging and changes in my face would happen is I did some Sculptra. So Sculptra is a unique injectable in the sense that instead of injecting something that's almost like a filler that is an implant, it rather stimulates your body to produce your own collagen. So areas in particular where we put it are in kind of tear trough area, malar area, and what it's doing is it's basically signaling your body to produce your own collagen in that area. The nice thing about Sculptra is it's a very natural onset, peaks at about 6 months, but then it gives you a couple of years of volume. So it's done and then it's repeated usually about 4 to 6 weeks later. So other technologies that we use are SoftWave. SoftWave uses ultrasound as the stimulation in terms of the energy that can again produce the inflammation that causes again more collagen, and you get better overall skin quality. And then finally, we use a lot of Morpheus. And Morpheus is something that's microneedling, but it uses radio frequency. And that's the energy that better stimulates the area underneath the skin, produce more collagen, elastin, and get overall healthier skin. So these are basically skin tightening devices here. And then this is volume addition. So these are, again, things that I personally have done and that we offer here at APSI Skin Clinic. Okay, so the next thing that does happen in everyone that takes these GLP1 agonists is muscle loss. So you'll get anywhere from 20-25% of the weight that's lost can be muscle. So we really want to minimize that. And it's very important that people understand that the medication by itself, it's not what we call monotherapy. In other words, you don't just take a tablet and expect that to do everything. You have to increase your protein intake. You have to do weight training, resistance training, and things that are going to stimulate those muscles so that you lessen the amount of muscle that is ultimately lost. People talk about Ozempic butt as one thing, mainly because the gluteus muscle is one of the biggest muscles in our entire body and has a ton of volume. And so people can get kind of a flat butt as a result. So in addition to doing things like, squats and lunges that really stimulate that muscle, you have to increase that protein intake so that when you are not taking in as many calories, because you're really just not that hungry, you really have to say, okay, I'm going to make sure that what I'm eating has a lot of protein in it. And so a couple of things, that I've used, I like the Keon protein powder. I take this basically every morning. I also use the creatine. Again, that's kind of more for energy. A couple of bars, that I like are the Bear Bells. They've got this one's, cookies and cream. This is birthday cake. Who doesn't like that? These taste more like candy bars than some of the, sawdust, protein bars that are out there. It's very important to understand, that you need to be looking at probably taking in like 100 grams of protein in a day. And again, that's a lot. I mean, a chicken breast by itself can be like 20, 25 grams, depending on how big it is. But I mean, how many chicken breasts can you really, take in? So again, you just have to be cognizant when you're planning not only your activities to stimulate the muscle, also increasing your protein intake. Here's another one. Is something that some people experience, which is hair thinning. Not everyone does, but again, in an effort to sort of prophylactically treat it, I use the ISDN system. So it's kind of cool because it has both tablets, it has a shampoo, and then it has a spray. And it's really easy to use. It doesn't really, change your routine much. And it's not that you can't also use your own shampoo that you've used in the past. Again, this is just ways to sort of help stimulate those follicles, both topically as well as, the oral tablets. Some people use the Nutrafol system as well. Again, I think these are all great systems. It's mainly just trying to do something prophylactically to try to get as healthy a hair follicle as possible. Another thing that people talk about early on, talk about nausea that people have, and that's why we start everybody at a very low dose. And then another one that can be kind of an issue with people is constipation. Really seems to affect women more than it does men. But I think the important thing to understand is that you need to do something to supplement your ordinary diet to try to, again, mitigate that, because there's really nothing more frustrating than being constipated. Personally, I've gone to using these Metamucil tablets that I take daily. I've really increased my water intake as well to further mitigate that. And then, I use this pre-probiotic, and I'm not in any way suggesting that these are the only two things. I'm just telling you, that's worked for me. The weight loss journey is great. I think that it's a neat deal for people to be able to get back to a healthier weight. A lot of people are uncertain whether it was safe and whether or not, their bodies would be able to handle it. And I can assure you that the medication has been out there for many, many years. The health benefits of having a lower weight with, less heart disease, less stroke risk, less stress on your joints, all of those things, are reasons to do it. But let's face it, if you are usually at a lighter weight and you look better and you feel better, then I think that's, again, the other benefit of using the medication. So if these are things that interest you and you would like to have a consultation to discuss, then contact us, and hopefully we can see you here and get you on your weight loss journey.